Hi, I'm Dr. Castanet. Today I'm going to talk to you about the common problem of sciatica, define what it is, tell you how we treat it, why we treat it the way that we do. I'm going to use a model to show you exactly what it is. First though, let me explain. Sciatica, you probably know, is pain in the distribution of the sciatic nerve. The sciatic nerve is a very thick nerve in the body. It starts in the buttock area. It is the aggregate of 5 different nerve roots that are in the low back and the sacral area from L4 through S3. These nerve roots in the low back exit from between different vertebrae and from outside little holes in the sacrum. And these 5 nerve roots might look like my hand, each of these being a nerve root. They come out, and there are 5 of these coming out each side of your spine. They coalesce or come together in the buttock region, and then as they descend down the buttock, thigh, leg, and foot, they send branches out so that that thick nerve made up of the 5 initial nerve roots then divides throughout its course down the leg to innervate different parts of the buttock, thigh, leg, and foot. When you have compression of one of the 5 nerve roots in the low back, either in the on the right or left side, any one of those nerve roots that's compressed, typically by disc material that has herniated out from a disc, if it compresses any one of those nerve roots, the nerve root becomes inflamed. The circulation of arteries and veins that supplies nutrients to the nerves, those are compromised. Nerves are extremely sensitive to pressure, so they will be affected. Their functions will be affected. Functions of nerves include motor functions, meaning how you move your muscles, sensory functions, how you feel, and sensory functions can be any number of sensations, from burning, tingling, numbness, sharp, dull, ache, dripping water, you name it. I've heard a variety of descriptions of the sensations associated with sciatica and nerve compression, but any of those sensory phenomena are possible. And then there are reflex functions that can also be affected. That's the sort of thing we would test for in an examination. But anyway, you probably know sciatica. You probably heard, it's such a common entity. Most people have heard from friends or family or know from personal experience what it is. Pain in the distribution of the sciatic nerve, meaning pain that typically starts in your buttock and then may be felt as the problem gets worse down your thigh, and then the leg, typically in the back or outside of the leg, and down to the bottom or outside of the foot typically. Other nerve roots can be involved that are higher in the low back, but that's less common. The most commonly affected nerve roots are those that will combine in the buttock and make up the sciatic nerve. So that's what sciatica is, pain in the distribution of the sciatic nerve. It's typically caused, and I'll use the model now for this purpose. This, to orient you a little bit, is a couple of vertebrae in the low back region. This would be the back of the person. This would be what you would feel if you were to put your finger up against the center of your spine. You'd feel these hard spinous processes. These are 2 vertebral bodies, so this is where your abdomen would be out in front here. These are 2 vertebrae. There's a disc in between. If I turn this on end so that you can look from above down, you see the disc here. This little red lesion is supposed to be a herniated disc. Herniation just means that the contents of the inner part of the disc have migrated beyond the normal boundaries. The contents in the center should be contained by the peripheral fibers out here, which act like a restraining basket in a sense. As these fibers wear out over time and degenerate, they become incompetent to restrain the inner part. The inner part then can begin to bulge, and if it gets bad enough, we will call it a herniation. It will come out in this direction typically, because this is where most of the wear and tear occurs in discs. That's a function of the way in which the spine is able to move. It moves mostly bending forward rather than backwards. As a result, the posterior fibers are under more pressure and stress over the course of a lifetime. So these wear out. This inner part can come out. When it does so, the nerve roots are right back there. They're in the neural canal right behind the disc. So if the nerve roots are coming down the spine and then exiting on the sides, as these do on the sides, they can be pinched either by discs that are coming out and pinch the nerve as it descends down the canal, or they can pinch a nerve as it exits above. That's less common. More typically, a disc herniation will involve the nerve root that's going down the canal on its way out at the next level. So that's what a disc herniation is, the most common cause of so-called sciatica pain. How to treat this best? Well, effective treatment must improve this lesion. It must get this lesion off of the nerve root so that you feel better. Typically in medicine, the way this is treated is they'll send you for exercises which won't do anything for a significant disc lesion. It may help a disc bulge, an earlier disc lesion, or they may send you for injections to treat the inflammation that's a consequence of this. Part of the inflammatory process is swelling, and so insofar as an epidural steroid injection is effective as an anti-inflammatory and reduces the inflammatory problem, and hence the swelling, it may improve this complaint. It's a fine way to treat this, but not as a first measure. The first measure should be to anatomically, mechanically reduce the size of the disc herniation. That's possible through a treatment that I use called spinal decompression. In the olden days, we used traction, which were very crude machines that would pull and separate the vertebrae to encourage the disc to return to its normal place. It was an effective treatment if you applied it appropriately and long enough, but the fact is that this used to be done in hospitals over the course of a long time. That's not feasible any longer because of expenses, and so that's in large part why the treatment has fallen out of favor. The tables were also crude and not very comfortable, and as a result not effective. Something's got to be comfortable and tolerable before it can before you can exploit it for its potential efficacy or effectiveness. So the newer tables, the spinal decompression tables, are much more comfortable, and as a result you can the patient tolerates it very well. Very often people, when you treat them with spinal decompression to reduce a disc herniation, very often they'll fall asleep on the table. It's that comfortable. The table gently and comfortably pulls the vertebrae apart, reducing the pressure on the disc. That enables this material to migrate back in the direction it came from, because after all, the body wants to heal. If given the opportunity and a modest impetus for that, it tends to heal itself. So you can elicit and take advantage of that potential by distracting it, getting this to go back. That improves the status of the disc. There is the potential for partial regeneration of the disc and healing, and that's the best way to treat it. If that fails, then I will recommend epidural steroid injections, but this is so often effective that I probably, for significant back and disc problems, I probably refer maybe 5% or less of people for epidural steroid injections. I have also treated many people who have already had the epidural steroid injections and who either failed to improve from them, or the improvement wasn't lasting, or they don't want to continue to get epidurals for years and years until the problem progresses to the point that it's surgical. So that's my suggestion and recommendation for the treatment of these disc lesions resulting in sciatica. If I can help you, please call me. I'm in Decatur, Georgia. I serve the Atlanta metro area. I'm right on the 285 interstate, or right off, so I'm very convenient to get to from any place in the Atlanta metro area. My number is 404-558-4015. Thank you.